Hello, I'm at the University of Minnesota right now, but this data is out of Mayo Clinic, Rochester, where I was last year, just to clear that up. I worked with Drs. Lecca, Karup, and Atwell on this project. Purpose of the study was to determine the rate of major bleeding complications for ultrasound-guided paracenteses performed by radiologists in patients with pre-procedure platelet counts less than 50,000. And also to better understand whether or not it is necessary to obtain pre-paracentesis platelet levels or attempt to correct thrombocytopenia with prophylactic platelet transfusions. This was an IRB-approved, HIPAA-compliant retrospective study. We searched the electronic medical record for all paracenteses performed at the institution between January 1st, 2005 and July 22nd, 2011. There were 9,792 of them. Only 304 met our inclusion criteria, and that was it had to be an ultrasound-guided para performed by a radiologist, so either staff radiologist, fellow, or a resident under direct supervision by a staff radiologist. Most recent platelet count within 2 days of the procedure had to be less than 50,000 without receiving a pre-procedure platelet transfusion. 69% of the patients were male, mean age 56.6 years old, mean platelet count of 38,400, lowest platelet count was 900, going up to 49,000. Mean INR of the group was 1.6, ranging from 0.9 up to 4.6. Standard paracentesis technique with real-time ultrasound guidance, 1% buffered lidocaine to the skin and peritoneum, 5 French UE catheter, plus minus color Doppler evaluation right before the puncture to make sure there's no big vessel in the way. Outpatients were not observed, and inpatients went directly back to the floor after the procedure. We sought the bleeding complications by reviewing the paracentesis dictation, and then also for inpatients to find evidence of bleeding. Reviewed 1 clinical note per day, the day of the procedure and 3 days following the procedure. And for outpatients, I reviewed the next 2 clinical notes to look for evidence of bleeding. If there was thought to be evidence of bleeding, there was further investigation of the relevant imaging studies, clinical notes, and lab values. So out of the 304 included patients, there were 3 major bleeding complications requiring packed blood cell transfusion.